Welcome to today's Health Matters. Do your kids like to play sports? Are they on the football team, soccer? Are they in cheerleading, drill team, or do they just like to ride their bikes? If they're doing any of these kinds of activities, then they're at a risk of getting a concussion. Sports-related concussions are on the rise, so it's more important than ever that you know what a concussion is, the signs of a concussion, and what you should do if your child has a concussion. Joining us today to answer these questions is Dr. Nneka Ifejika, Associate Professor of Neurology and Director of Neurorehabilitation at the University of Texas Medical School at Houston. Let's see what Dr. Ifejika has to say about sports-related concussions.
A concussion is essentially a traumatic brain injury without showing findings on a CAT scan or an MRI. So suppose you have a concussion. The symptoms that you would have would be headache, nausea, vomiting, some confusion, possible irritability. Some people have problems with light and sound, which is called photophobia and phonophobia. If you do suspect a family member of yours, one of your children, has a concussion, you need to make sure that they stay awake because of loss of consciousness can lead to other complications. You should have a low threshold to take them to the emergency room, especially if they have nausea, vomiting, or worsening confusion.
Thanks for that great information, Dr. Ifejika. For those of you just joining us, we just heard about what a concussion is and how we can figure out if our child is having a concussion. Now I want to focus on preventing a concussion. So Dr. Ifejika, can you tell us and tell the viewers out there what they can do to lower the risk of their child having a concussion?
That's a great question, Dr. Noser. The best way to prevent concussions is education. Education of your family member on proper tackling techniques if they are, say, playing a contact sport such as football. Education on what to wear, so the proper type of helmet. Specifically, the helmet fit and wearing it appropriately on the head. Some people wear their helmets farther back than they should, and they tend to have problems with injuries to the front of their brain and the frontal lobe. It's also very important if you have a family member who plays a contact sport, but it's not really a contact sport like soccer, to be aware of heading the ball. We've had a lot of people coming in who've been having concussions due to heading the ball. Also looking at gender roles, male versus female. Women soccer players and women gymnasts tend to have more severe concussions, so be conscious of that in your family members.
I'm Dr. Elizabeth Noser, and you're watching Health Matters, where we've been talking about concussions. What is a concussion and how we can prevent a concussion. Now I want to focus on treatment. So Dr. Ifejika, can you tell us if our child has a concussion, what are the treatment options? And also, what's recovery like and what's the time frame?
The best treatment for concussion is actually getting rest. Not just physical rest, but mental rest. So for kids who are in school, actually talking to the principal and talking to the classmates as well as the teachers about what's happened and that they will need additional time, say, to complete homework assignments or other tasks. The most important thing when treating concussion is they need to have a complete break until they are symptom-free. And I know a lot of parents out there and a lot of kids too want to get back to play as soon as possible. That is absolutely out of the question. You want to make sure the symptoms have completely resolved because if you do not, you're at a risk of something called second impact syndrome. That means if you have one concussion, you don't fully recover, you have the second concussion, it actually builds on the first concussion, and you can have continued symptoms for a longer period of time. You also have problems with bleeding on the brain, which is why it's so important to have one concussion completely resolved before returning to play. If you continue to have problems with your memory, with irritability, with insight, which is your ability to make rational decisions, as well as with judgment, you need to make sure you get something called cognitive rehabilitation. That's usually available through an outpatient therapy center, through neuropsychology counseling, as well as speech and language pathology counseling.
A special thanks to Dr. Nneka Ifejika for joining us today and teaching us all about concussions. Thanks for watching Health Matters. I hope you enjoyed the information on concussions. We'll see you next time, and don't forget, your health matters.